wish you had a skincare therapist bestie with over a decade of experience whisper skincare tips, ingredients, and solutions in your ear? Welcome to the Skin Coach in Georgia podcast. I am your host, Mayade Samini, a clinical esthetician and founder of Urban Skincare Clinic. Whether you're challenged with acne, rosacea, dark spots, or just want to learn how to maintain a healthy glow, this podcast is for you. Let's transform your skin one episode at a time. Hello. Welcome to another episode of the Skin Coach in Georgia podcast, sponsored by Urban Skincare Clinic. How's your 2023 going? I hope you've had a great start to your year, and I'm feeling good about 2023. So if you've been a listener of this podcast, you've heard me say that my goal, especially with the podcast, is to be an esthetician friend to women who need help with their skin. And my mission is to bridge the gap between unqualified skincare advice and paid consultations within my scope of practice, of course. With that said, I have a very special guest on the podcast today. I am interviewing Dr. Mark Yune, who is a triple board certified facial, plastic, cosmetic, and reconstructive surgeon in the Atlanta area. I hope you enjoy and learn something new from our conversation. I am going to read Dr. Yune's bio before playing that interview. All right, here we go. So Dr. Mark E. Yune is a triple board certified facial, plastic, cosmetic, and reconstructive surgeon by the American Board of Facial, Plastic, and Reconstructive Surgery and the American Board of Head and Neck Surgery, a diplomat of the American Board of Cosmetic Surgery, and a fellow of the American Society of Cosmetic Breast Surgery. After graduating with honors from medical school and residency in head and neck surgery at Indiana University, he was selected for 1 out of 37 fellowships in the country in facial, plastic, and reconstructive surgery with an emphasis on cosmetic facial surgery. His thesis paper for completing his fellowship was a DART procedure, a new technique using structural grafting for revision rhinoplasty, which is surgery on the nose, in the over-resected nose, reestablishing a natural appearance while simultaneously improving the airway. The fellowship, sanctioned by the American Academy of Facial, Plastic, and Reconstructive Surgery, AAFPRS, was administered by their recognized authorities in association with Emory University in Atlanta, Georgia. During his fellowship, he served as a clinical instructor for Emory University, training other physicians and residents while working with leaders in the field of facial plastic surgery to achieve the highest level of training available. He furthered his education in cosmetic breast surgery and tumescent liposuction through a variety of preceptorships, primarily in Southern California, over a period of several years. He continues to further his education through the AAFPRS, American Academy of Cosmetic Surgery, American Society of Cosmetic Breast Surgery, American Society of Cosmetic Physicians, and various other societies. He is a founding member of the Georgia Society of Cosmetic Surgery. He has been featured on CNN, NBC, CBS, Discovery Health Channel, She TV, Women's Entertainment Network, Time Magazine, New You Magazine, and a variety of other media. Dr. Yune is committed to excellence in the highly specialized fields of facial, plastic, and cosmetic surgery. And without further ado, I am going to play that interview. Thank you so much for coming onto the podcast, Dr. Yune. We are excited to learn from you today. So tell us, how did you get into facial, cosmetic, and reconstructive surgery?
Well, I just really enjoy art And I feel like it's as much an art form as it is a science. I really like the creativity of it. And I have a nickname for it. I call it happy medicine. So we really get to enjoy fun visits with our patients. That's kind of a unique niche in medicine in general, right? Because most of medicine's taking care of sick people. I actually take care of people that are well, that are just trying to accomplish something to help their self-esteem. So we get to deal with happy patients typically, and it just makes our day so enjoyable. I feel so privileged to be in this field.
Absolutely. Wonderful. Why don't we start with injectables? A lot of my clients, they're thinking about it. They're on the fence. They don't know too much about it. They're, scared to try it. Let's talk a little bit about injectables. Who's the ideal candidate? And this is for neuromodule Botox and filler. Who's the ideal candidate? Is it ever too early or too late to get into injectables or try them? We're all ears.
Oh, that's a great topic to start off with, simply because injectables in general are the most common cosmetic treatment that's non-surgical. In fact, it's just the most common request across the board, frankly. So you brought up neuromodulators. There's sort of two main buckets as we talk about injectables. The first one being neuromodulators. So everybody knows the term Botox. They also have some competition in another product called Dysport, Xeomin, Jeuveau, and Daxxify is the newest kid on the block. It's important to know there are different options. But what a neuromodulator does is it modulates or it controls excessive movement. And where we apply that is to undesirable muscles. So what I mean by that, I just call them real basically the depressor muscles of the face. So there are muscles that age you faster than gravity. And if you look how a person ages over time, you'll see certain consistencies. You'll see a grimace between the brow, creating what my colleagues call the 11s, furrows. You'll see lateral canthal lines called crow's feet. Mm-hmm. But those two muscles, when they activate, they actually push your brow downward, depressors. Those are on label. FDA has approved cosmetic use for glabella, and crow's feet is how we call it. The lower face actually has depressors too. There's a muscle that pulls the mouth in an angular fashion, the depressor anguli oris, just called the DAO. And there's muscles that band the neck. That's called the platysma. Mm-hmm. These two lower face muscles age your face faster than gravity. So what are we using neuromodulators for? We're using it for prevention. We're using it for maintenance. It's really the only preventative tool we have. So when you see people that get Botox regularly, especially to those 4 depressor muscles versus those who do not, it's dramatically different. The 2 lower face depressors are off label, just so your audience understands that the FDA hasn't approved it for cosmetic use. I'm comfortable using it off label. I have since the beginning of my career using Botox nearly 30 years ago, because that's how we've kind of always used it. Anecdotally, it might be interesting for you to know that Botox was first released in the late 80s for essential blepharospasm. That's the involuntary twitching of the eye. And early adopters recognized that reduced the crow's feet. But it took several years to get FDA approval for cosmetic indication, because that's just the way the FDA works. Cosmetic indications are not a priority to them. They have to worry about drugs and vaccines that are for medical indications. So I think we'll get FDA approval for lower face because the safety profile is just as good as upper face. And I've been using what I call the Botox assisted facelift for 30 years. It's just worked beautifully for me.
Wonderful.
And that's a lot on neuromodulators that's enough. The second main category is fillers, otherwise what we call volumizers. Mm-hmm. And the biggest category in use today is hyaluronic acids. Mm-hmm. HAs, call them. I love the HAs because it gives us a safety profile that's unbeatable. And what I mean by that is there's an enzyme to melt undesirable HAs. So God forbid you get a result that you don't like, you can actually reverse it. And that enzyme's applied 1 or 2 times, and it can pretty much reverse the undesirable effects in a day or 2. So you don't have to live with a bad result. And a lot of patients don't know that. The HAs last from 9 months to 2 years. And we're using filler where there's need for volume. As we age, we go through a process that we call in medicine atrophy, where things just shrink. Okay, so the most popular areas to apply fillers, that would be like the lips. I think girls start losing volume in their lips as soon as they graduate college. So it's not uncommon to do a little lip augmentation in girls in their 20s. Cheeks, a lot of times we'll build up the cheek mound, and that can actually create a lifted look. So anytime you put volume in the upper face, it helps pull up the lower face. Temples, another common area. As people get really thin, they'll get a temporal hollow, which really ages the face. We'll use it around the mouth and the folds. We'll use it in the glabellar folds, the chin, jawline, anywhere that needs volume. Even off-label, we're using it to augment noses. That's a, high level. You need somebody with a lot of expertise and understanding of the vascular anatomy of the nose, because you always have to get complications, which are avoidable if you really use a safe technique.
Right.
We even augment hands. We'll even do scar tissue that's indented, and even buttocks. Okay. The other categories, so just as an offshoot, we'll use some polylactic acid. The trade name is Sculptra, and we'll use that as a stimulator. So when you inject it, has a delayed effect. It usually takes place in 6 weeks. It requires repetition because you don't want to overdo it. So most patients will go through about 3 sessions separated by 6 weeks or more, just depending on what the patient needs.
Is Sculptra a form of a filler?
So it's not really a filler per se. That's why I was telling you the word is stimulators. But what it's stimulating when you inject this product, it's quite an ingenious product, frankly, because it's a similar product to the dissolvable sutures I use, for instance, in a face. What somebody realized is when that stitch was reopened, there was a ball of scar tissue around there. So it made sense to take that same product, powderize it, suspend it in saline and local anesthetic, and inject it, creating that same collagen replacement of it. And that's what takes 6 weeks. So it's not really a filler, but it gives you volume by stimulating your own collagen.
Right.
Yeah.
Wonderful. I do want to ask a quick question. Okay. So you did mention with fillers, they are reversible. They're dissolvable, correct? That is not the case with Botox, correct? If someone, let's say, receives Botox and they feel that heavy feeling on the eyebrows, do they have to wait until it wears off, or is it correctable?
Well, the good thing about Botox, if you don't like it, is it does go away. And it lasts about 3 to 6 months, depending. Most interval is 3 months. That topic you bring about the droopy brow, well, that's the most common complication, if you will, caused by Botox. And it's basically always avoidable if you know what we just talked about, the depressors. Where you get the droopy brows when you start using it in the mid-forehead on up. The forehead muscle that causes these horizontal lines, that's a lifting muscle. So if you Botox that brow's coming down every time. And we will treat the forehead once we've accomplished a lift of the brow by treating the glabella crow's feet. Once you've established a lift, then you can treat the forehead knowing you're going to actually offset some of that lift. So the patient has to really understand the dynamics. And then you can always avoid a droopy brow. But that's really common in this era of Botox being so popular. A lot of people are just doing it with all due respect, weekend courses. And in my practice, we have what's called Dr. Yune boot camp, where I put my injectors through a year's worth of training. Yeah.
That's great to hear. I always tell my clients, just as you mentioned, it's an art. Go to someone who you know, like, and trust, and they have credentials. Absolutely. All right. The next question is, who is an ideal candidate for a facelift? And is a facelift permanent?
Okay. Good questions. Right up my alley. One of my most popular procedures is the facelift. So when we talk about facelifts, we're usually talking about like temple, cheek, jawline, neck, extended collarbones. And then some people will call the upper face brow lift. We'll get to that in a little bit. But I think with any surgical procedure or even non-surgical, you have to consider safety first. And by that, I mean making sure you're operating on somebody that can tolerate general anesthesia. Some people will do this under IV sedation. My preference is general. But either way, I think you should, depending on their age, get a medical clearance from their primary care doctor, cardiologist, whatever is applicable. So you want to take a thorough medical history too. Even though we're practicing aesthetic medicine, it's still real medicine. In fact, you almost have to have your guard up more so because, like I said earlier, we're dealing with healthy patients, right? So it's easy to kind of let your guard down. Can't do that because it's just as serious as a heart transplant. So we have to have safety first. Facelifting really needs to be done on somebody with realistic expectations. So consider a facelift probably the most rejuvenating to the lower face. But we already talked about two other buckets. Bad muscle movement. Well, that's treated with Botox. Volume loss, that's treated with filler. But I would tell my patients typically a facelift is going to be 3/4 of the equation. It's the majority of rejuvenation. And it's not that hard to imagine because really what a proper facelift surgeon does is they don't really make you look different. They make you look younger. And my patients over the course of 3 decades have told me the average rejuvenation is 10 to 15 years in appearance. It's literally this, what you do in the bathroom mirror. And if that's what you like, that's what you're going to get within reason. The facelifts hold up based off of your skin's elasticity. And so fortunately in this era, we have devices. I call them the energy-based devices. That would be radio frequency and ultrasound and plasma. And these kinds of things heat the soft tissues, creating better elasticity. That thermal injury creates basically a shrink wrap effect. So when a patient gets a facelift, you're going to experience some sagging as it's healing. That's just the elasticity dictating where it ends up. You find that out at 3 to 6 months when the swelling is gone. And then you decide if you want to implement energy-based devices. They're subtle, so you have to do multiple treatments. We usually say 3 or more is the sweet spot. My 2 favorite devices in my clinic are Ultherapy and Secret RF. And then again, when the swelling is gone, you decide if you want to add filler and Botox to maintain. It's a really an educational process to make sure the patient knows what to expect many years down the road. So you talk about permanency, and this is always an interesting question because if you do a proper facelift, we're going to set your clock back 10 to 15 years. That's always going to be with you. The problem is you get the aging process starts day one after the facelift. So you will always look relatively younger. So in that regard, that portion is permanent.
Wonderful. Wonderful. Next on the list is, what do women need to know before considering plastic surgery? I guess that's kind of a broad question.
Yeah, that's a pretty broad question. And maybe we can kind of break it down into key points. I would tell you that the first thing to do is understand how to find a good provider.
Absolutely.
That's not easy for the consumer because there's a huge onslaught of marketing in cosmetic surgery. And so what a consumer needs to do is understand how to vet a provider. So understand that plastic surgery is so wide and broad now. It's specialized into certain areas, if you will. There are those who just do reconstructive surgery. That would be like repair for breast cancer, for instance. There are those who specialize in just burns, those who specialize in pediatric craniofacial cases like cleft lip, cleft palate. Cosmetic surgery is a whole different animal. And when you have the privilege like I did to do a fellowship, you really can gain a lot of experience. So there are these things called fellowships, which is training specifically in cosmetic surgery that gives the trainee hundreds to thousands of cases in a year or two. And this is obtained after residency. So you hear the marketing term frequently, only trust a board certified plastic surgeon by such and such board. But that really is the tip of the iceberg. You got to realize board certification is an indicator of general knowledge. It does not indicate what you specifically trained in. So don't be ashamed and don't be concerned about asking your prospective surgeon, what did you train in and what was involved? So I'm getting on this because there's a lot of work being done that's not ideal. And I think that's because of lack of training. You can actually, with the proper board certification, get carte blanche hospital privileges to do whatever you want to, including cosmetic surgery, even if you haven't done a single one in your residency. That's a problem. And I'm passionate about this because at any given time, sometimes over 50% of my surgical work is correcting bad jobs, what you guys refer to as botched jobs. Now there's a TV show about it. And it always breaks my heart when I see these people struggling who've had bad work done. Fortunately, there's ways to fix some of it, but some of it you can't fix. So make sure your surgeon is experienced and trained in the area of interest. You can vet that through pictures and reviews. With pictures, I think it's really important to show a huge cross section of your work. I went to my website designers and said, I'm going to put 1,000 pictures on my website. And they said, well, that's ridiculous. Nobody does that. Don't you want to put out your 3 best examples? I said, no, that's not really honest. We have to be fair and show them all my work. So they obliged. And I think that's one of the favorite things about our website is that patients can really browse numerous cases and get a real good feel. Because I think we really need to emphasize, improvements that look natural. I want all my patients to look like they just look rested, they look 10 to 15 years younger. In this business, we have a saying that if it looks like they've had a facelift or too much filler, that's just bad work. So that's always avoidable. But that's the part that you need a lot of training in to understand the aesthetics, because it is artistry. It's not just cut and sew and fix a hernia, right? We got to make it look good, especially facial surgery, because you're not covering that up with a garment. Right. So, understand there's a level beyond board certification. And most patients that come to reputable practices, they typically are built by direct referral. You come because your mother and sister look great and normal. So vetting through other people and patients, I think it's always good to get a couple of opinions. I'll encourage my own patients when they're consulting with me. It's not a bad idea for you to talk to other folks. So that's kind of a lot of words.
Absolutely. Wonderful. What is the best procedure for under eye bags, hooded eyes, and what's the recovery time like?
So the most popular rejuvenation surgery, if you will, is eyelid surgery, otherwise medically called blepharoplasty. So let's just call it eyelid surgery. And so under eye bags, let's start with that. That's usually an inherited condition where the orbital fat, so you have fat around your eyeball in your eye socket. Some patients will have a bulge, and that's because a very thin membrane that holds the fat back is weakened, or there's just an excessive amount of fat, creating an undesirable appearance where people feel like they're too bulgy or baggy, or called different circles, if you will. You really have to understand how to diagnose the anatomy to treat it properly. So as a surgeon, what I'm doing is I'm evaluating that patient, because if you really have a fat bulge, let's call that the hill. We want to take it down to sea level, and that's done surgically. What most people have with a bag is they'll have a little trough below it called the tear trough. Now, if you go to a clinic that's just offering injectables, you might get that tear trough filled. That's not going to be a better aesthetic most times. It's just going to look like a taller fat pad. So what you really want to do, which is fortuitous for the surgical patient, is do the surgical procedure to take that fat pad down to sea level. See where you end up at 3 to 6 months. That's when swelling is gone. And then decide if you even want filler, which more times than not, my patients don't care to do because it requires maintenance. See, in overhead lighting, the overhead light casts a shadow below the fat pad, making it look like a dark circle when it's not pigmentation at all. It's just a shadow. That is often done in conjunction with a lower eyelid lift, because if you reduce fat pads, you're going to create some more wrinkling. So it usually requires some suspension. And in fair skinned people, we can do a laser type resurfacing to the lower eyelid skin to create tightening. And that has to be done very judiciously, because you can't do laser resurfacing on dark brunettes or darker pigments. So sometimes you have to leave a wrinkle or two behind. But I'm not doing a lot of skin removal below the lower eyelid, because that can create a real problem where the patient's getting lower eyelid rounding, or what's called ectropion, and it can give them dry eye syndrome as well as a very negative aesthetic appearance. So really got to be cautious with how you handle the lower eyelid. The lower eyelid fat pad, if it's just fat we're removing, that's an incision on the inside of the lower eyelid. So it's a hidden scar. Now, upper eyelid surgery is as popular, if not more popular. Eventually, we all get the curtain coming down. Excess skin. But also, in conjunction with excess skin, there's oftentimes a fat pad toward the nose. We call it the nasal pocket. So, see, eyelid surgery is not just skin removal. It's muscle contouring, ligament tightening, skin resurfacing, fat pad reduction. And then you really have to understand a patient's anatomy and how do you approach it. So we do video imaging, we take pictures, we give them realistic expectations, we take those pictures to the OR so we can target our surgeries very precisely. Everybody's different. When you do this surgery enough, you'll realize each case is different. That's the artistry. So eyelids are the most popular because it has a high aesthetic value. We studied this years ago. We noted where people looked when you asked about youth and beauty, and we'll spend 80% of the time looking at the eyes and mouth area. That's the heavy hitters, eyes and mouth. Plus, the skin's thin, doesn't have many oil glands, so your eyes are going to age much faster than your cheeks, your lower face. We're doing eyelid surgery sometimes on people in their 30s.
Absolutely. So interesting. Wonderful. What is the biggest misconception when it comes to cosmetic plastic surgery for beautification, I guess? Yeah.
I would tell you there's a couple, and I've mentioned earlier that board certification equates to expertise. I would tell you that, again, shopping wisely, because you really don't want to find your surgeon just because he's in a fancy magazine ad, right? So dig a level deeper and understand that there are specialists who've had additional training. And when you're doing something over and over again, you tend to give better outcomes and have a better safety profile. Biggest misconception is all plastic surgeons are created equal, and it's not that way. The other misconception is that plastic surgery always looks plastic. It looks done. And also, as we mentioned in the past, if it's done properly, you really don't leave any footprints behind. Even with facelifting, with scars hidden around the ear and into the hair-bearing scalp. Eyelid surgery with the incisions hidden in the crease. On the lowers, it's on the inside. You can do upper and lower eyelid surgery, facelift, and even rhinoplasty and not see any visible scarring, no matter how you wear your hairstyle. So that's just understanding where to place incisions, how much tension you can place on it. The facelifts that you see have too much tension on the skin, pulling the earlobe down. This bump in front of your ear canal called the tragus being pulled forward, or just wide scars that are unsightly. So understanding how to do a layered approach. We talk about the SMAS, the SMAS lift. Whether you do a SMAS or a deep plane facelift, that's really your tissue that holds well. That's what gives you longevity. I know there's a big trend toward mini facelifts, which are local anesthesia, small incisional pattern, small skin flap. But what we've noted with those types of cases, even though it's convenient, easy, and less painful with less downtime, the results are less too. So my theory is if I'm going to make that incisional pattern, I'm going to give them the maximum result. So I'm not a big fan of the mini facelifts, even though they become so widely popular. You really have to understand facial anatomy, where the face curve that allows your face to move lives to do a proper facelift, what my nurses call the actual facelift. So that's really important to understand that.
What is a typical downtime after a full facelift?
Okay, so I always call these the milestones because downtime is translated differently depending on the person asking. And I think what patients, so I think what patients are most concerned about is, okay, when am I going to look normal? Well, that's going to be about 10 to 14 days. I call it restaurant ready. Then what matters to us as healthcare providers is when are things going to be sturdy? That's 6 weeks. 6 to 8 weeks is when you have maximum wound healing strength, or what we call tensile strength. So the scar can't be disrupted if you go do heavy exercise or sleep with your face on the pillow. So 6 weeks, I call that graduation day. Carte blanche, do whatever you want. But it actually takes 3 to 6 months for soft tissue swelling to subside completely. And in noses take a year. We actually manage noses with cortisone shots for pockets of swelling up to a year. Millimeters matter, right? So that's why we're managing our noses. It takes 9 months for nerves to wake back up so you feel what my patients call like the new normal, because there's a lot of sensory nerves that get disrupted. While you're healing from surgery, some parts will be a little sensitive, some parts will be numb. 9 months before you feel no physical signs or symptoms of having had the surgery. And then it's a full year before scars look their best. So you have to follow your patients throughout the whole year and more if necessary. Very rarely will you deal with some thicker scars that happen more typically in darker skin types. You might see that in some Asians, some American Indians, African Americans. And those can be managed quite successfully with cortisone shots, lasers, steroid injections we talked about, and then maybe microneedling. So you really have to know how to manage a patient to the finish line. But those are your key milestones.
Wonderful. So worth it at the end. Okay. Thank you so much for answering all of our questions. Anything else I am not asking that you would think it would be valuable to our listeners?
Well, we certainly covered a lot of territory there. So I think I would just want to emphasize natural appearances, vetting your provider, and having realistic expectations, and safety first, always. So I hope we gave your listeners some good material there. And I really appreciate you having us do this for you.
Thank you so much. We appreciate your time. And that's a wrap. I hope you enjoyed this episode. You can find the link to Dr. Yune's website in the show notes of this episode. Go check him out. As he mentioned, make sure you do your research before making a decision on the right provider for you. But I also want to encourage you to follow that voice in your head and do what you think will make you happy, what's going to make you feel better about yourself. If you've been thinking about trying Botox or a facelift or a solution for your acne, make that first appointment, meet with someone, ask questions, and you'll get more clear on what's right for you. And remember, nothing changes if nothing changes. All right, ladies, I hope you have a great February. Come say hi on the internet. Just search Urban Skincare Clinic on Facebook or Instagram, or you can email me at hello@urbanskincareclinic.com with any feedback. I'll catch you on the next episode. Bye for now.